Did you realize that nearly 2.7 million athletes around the United States will suffer from some form of a concussion just this year? More often than not, almost everyone has either heard of a concussion, suffered from one, or knows someone who has had one. However, very few of us know the true impact a concussion can have on us in the long run and a few of the ways you can help prevent them. Concussions are a major problem for athletes in this generation. So I believe each of you would benefit greatly from learning the proper ways to prevent, diagnose, and treat concussions. After researching many advancements being made to safety precautions regarding head injuries, I feel it would be a good idea to educate all of you on those, as I'm sure many of us have had to deal with a head injury at some point in our lives. As I said before, thousands of athletes around the world are diagnosed with a form of severe head injury each year due to the lack of prevention methods, failure in diagnosing a concussion, and neglecting to follow the proper treatment plans. With that being said, let's take a look at a few ways to help prevent concussions. One sport that has many athletes suffer from concussions is football. However, officials have been taking many steps in creating safer equipment to help prevent head injuries. As stated on Harvard's blog by Dr. Michael Craig Miller, athletes who compete at a high level accept the dangers and hard work while also enjoying the game's challenges and rewards. Thus, long-term effects don't become prevalent until after retirement. Therefore, officials are always looking for new ways to innovate the protective equipment we already have. Mechanical engineers Per Renal, Jonathan Posner, and neurosurgeon Samuel Brown have communicated tirelessly producing a football helmet called the Visus 01 Tech. The Visus 01 Tech appears to be a typical football helmet. However, it has been designed specifically to help prevent head injuries during football games. It is constructed of an outer lobe shell that is deformable, as well as an inner layer of columnar structures designed to absorb the force of impact. Therefore, rather than just containing one shell of padding, it consists of two. One layer has the ability to redirect the impact of contact. Most of the skilled NFL players have now switched over to using the Visus 01 Tech because of the new technological advancements. As you can see, this is a typical football helmet that only has one layer of padding, and that's the Visus Tech 1 that has two layers. Along with creating new devices to try and prevent head injuries, many of the professional sports leagues are implementing fines if a player intentionally makes a move on another player with the intent to cause injury, specifically a head injury. According to the NFL, each time it is believed a player has head-to-head contact with another player with the intent to cause injury, they are fined a minimum of $10,000. This fine was started to try and help eliminate the amount of head-to-head contact during each game. Not only are officials designing new rules and equipment to try and prevent head injuries, but they are also working on a more accurate way to diagnose concussions in the earlier stages. The first way in accurately diagnosing a concussion is the ability to be able to recognize the early onset symptoms. According to UMPC sports medicine officials, the early onset symptoms to look for in someone who has a suspected concussion include headache or migraine, dizziness, nausea, fatigue, cognitive problems, mood changes, or sleeping pattern changes. The second step in properly diagnosing a concussion would be to seek attention from a medical professional. The UMPC officials also concluded that when properly diagnosing a concussion, your doctors will run tests to evaluate your hearing, vision, reflexes, balance and coordination, memory, and attention span. This can be a great indicator in helping your doctor diagnose your concussion. If your doctor suspects a concussion severe enough, he or she may request that you receive a CAT scan or an MRI. Once again, the UMPC sports medicine officials said oftentimes when a severe concussion is diagnosed, your doctor may request an MRI or a CAT scan. These tests can help outrule any brain bleeds or hemorrhaging. Oftentimes, doctors run these tests as a precautionary. Many times, patients are diagnosed with a concussion or severe head injury. However, they do not know how to properly treat their head injury. Oftentimes, that can lead to a more severe brain injury. Patients who are diagnosed with a brain injury oftentimes don't follow the correct protocols for their recovery. Most of the time, patients just misunderstand their doctor's orders when they say to rest, but not too much. Health officials from Healthline.org informed many that yes, you are supposed to allow for adequate time for rest to allow the brain to heal. However, you are supposed to wake the patient up every so often. This is to prevent the patient from deteriorating. Too many times, people allow patients to rest and they wake up in worse condition than they were before they rested. Sometimes patients have been known to have a brain bleed, but they don't clearly recognize the signs of one. Some patients even require surgery. Health officials from Healthline.org have also stated sometimes a procedure is required for the brain to heal properly. When patients have a brain bleed and left untreated, it can result in further brain damage. A procedure can be performed to release the pressure inside the brain if the concussion is severe enough. Finally, sometimes doctors will even recommend over-the-counter pain medications to help with the swelling in the brain, which oftentimes may be the reason behind all of the pain. According to Dr. Michael Craig Miller from the University of Harvard Medical School, over-the-counter pain medications can oftentimes be prescribed by health officials to relieve some of the discomfort our patients experience with a head injury. The anti-inflammatory drugs can even help reduce the swelling within the brain. As we have learned, thousands of athletes around the world are diagnosed with a form of severe head injury each year due to the lack of prevention methods, failure in diagnosing a concussion, and neglecting to follow the proper treatment plans. As many of us have learned, head injuries, concussions in particular, are a very common occurrence in today's sports activities. But officials are taking many steps in the right direction to try and prevent these tragedies. Hopefully, you will never have to face the harsh reality of coping with a head injury. But if you do, you should now be well prepared for the steps in the most effective recovery. Thank you.